health spending reached $4.9 trillion, equivalent to nearly 18% of the U.S. economy.
I think that people shouldn't have to live their lives trying not to go to the doctor.
Yeah.
I think that AI has a chance to revolutionize healthcare in a way that benefits everybody.
But then there's long COVID effect, where people are having lung issues and heart issues from having COVID once. I'll just say it right now. We lead the entire world in avoidable deaths.
Generally, how I think of insurance is that I prefer not to have it.
But these politicians say that they've negotiated prices. They're fucking lying. Live from the time that was before this time, it's time for the Socially Awkwards podcast. I am Iron Matt, and he is the evil Branos. And we are the Socially Awkwards. Welcome to the pod. Today's episode, we're going to be ranting and raving about the U.S. healthcare system and everything wrong with it. Mr. Branos, we've talked about healthcare on this channel before. It was only a matter of time before we dedicated a whole episode to this. Give me like a general blanket statement from you of how the healthcare system in the U.S. is as of right now. You just give me one word if you want.
Yeah. 3 out of 10.
3 out of 10? Oh, you ranked it. Okay. Yeah, that's pretty bad too. So you could have just said 30% for the people that can't figure that out, because there are some people out there that might not be able to figure that out.
How about,
yeah, so we're going to...
3/10, I'll go with.
3/10. Okay.
Yeah.
So basically the same thing. You just doing it in a different way. I got you. All right. Well, we're gonna talk about. I'm gonna give you some facts about U.S. healthcare to begin. But first, I really wanted to talk to you. I wanted to plug my new book because it's an erotic thriller, and I've got a little synopsis here. Would you like to hear it? And maybe the people could hear it, so that way when it comes out, they might, purchase it.
Yeah, sure.
All right. Here it is. In a dystopian world where society lives in fear of the lip collector, a serial killer who lops people's lips off, a man named Randon falls in love with a pair of lips he finds on the street. But the lip collector wants his lip back, and Randon will do anything to protect his newfound love. It's a story of love and survival. It's called Labian Nights by Hansel Pandecker. That's my pen name. What do you think? Do you think that's a book you would read?
What's the character's name?
Randon. Nothing to do with you. No.
Randon, okay.
Yeah, it's just Randon. Yeah, I like that name.
Yeah, it's a unique name. I haven't heard that. I haven't heard.
Yeah, why do you need the B, bro? Get rid of the B.
What are we talking about? Bees? What's that mean?
Yeah, B. Get rid of that B and just call yourself Randon from now on.
Randon the Arabian, or what was the word?
It was Labian Nights.
Oh, there you go. Okay.
Yeah, Labian Nights, which sounds like a cool USA show from back in the day, maybe right after Silk Stockings or something.
Yeah.
Those are references people are not going to understand.
Yeah, this is good. Where can I buy it? You have an audiobook?
It's coming. And it's gonna be good, dude. I really wish Betty White was still around because she'd be like a great narrator for that book.
Yeah.
But it's an erotic thriller. But it's got, the lip collector. He's pretty evil. And he just cuts people's lips off.
Sounds like a no good kind of rotten guy.
Yeah. Yeah, and I feel like with women, he's probably cutting 2 pairs of lips off. So that's even worse.
Top and the bottom?
Yeah, top and bottom lips. You got it. All right. Enough of this shenanigery. That's a word. Let me talk about some facts of the U.S. healthcare system, because let me tell you, buddy, they're pretty bad. All right.
I like this. This is feels like a throwback all the way to episode 1.
Yeah.
It's like, let's start off and just hit you with some facts.
Yeah, we're going to hit you with some facts. All right. So the healthcare system is a mostly private, obviously high cost, mixed public-private system without universal coverage, with about 8.5 to 10% of the population remaining uninsured. It is the most expensive in the world, with health spending in 2023 reaching $4.9 trillion and accounting for 17.6% of the U.S.'s GDP. So that is insane right there. I think it's behind military spending. It is the thing that we spend the most money on. Well, it might be Social Security and then the healthcare. The U.S. is the only high-income country without universal health insurance, While 92% of people are covered, roughly 26 million people remain uninsured. U.S. health spending per capita is nearly twice as high as the average of other high income countries, largely due to the higher prices rather than the higher usage. Most people get insurance through employers, so 61% of the people get their insurance through employers, while others use Medicare or Medicaid. Major costs in 2023, health spending reached 4.9 trillion, and as we said before, that was equivalent to nearly 18% of the US economy. Chronic diseases, heart disease and cancer, drive the majority of these costs. Even with insurance, many people struggle with high deductibles, premiums, and out-of-pocket costs, leading to roughly 38% of adults with insurance worrying about affording care. Most individuals receive care from a PCP or a primary care provider within their insurance network. Patients may face unexpected high costs or surprise billing from out-of-network providers, even at in-network facilities. Despite high spending in the U.S., has lower life expectancy and higher rates of chronic conditions compared to other high-income nations. The uninsured rate, by the way, as of 2022, that's the latest I have here, 8.5%. It was 16% in 2010, the year before the Affordable Care Act was passed. So you can see how the Affordable Care Act, for as many pros and cons to that there was with the different, with people bitching about one thing or another, that it has at least made people insurable and gotten more people insured. When you hear some of those facts, is there anything that jumps out at you? I mean, I know that one big thing with me, maybe it's with you too, is the high spending. We spend so much money, and we've talked about before how they've already calculated, many different scientists and mathematicians and economists and all these other people have calculated that if we went to a universal healthcare system, we would be spending less per person. So what do you think about like all this so far?
Well, I think it is too much. Obviously, there's a little bit of offset you could probably do if you wanted to go through the sort of gymnastics of like saying that the US also has a really high GDP. So it's like you spend more on healthcare, but the average person in the US has more money to spend on healthcare. So, but even if you try to do any offsetting there, I think that it's just way too much. I was doing some offhand math while you said that. And I don't know exactly how many people are in America now, but I kind of tried to estimate on the higher side. So I took and I think I only did 4.1 trillion. I didn't realize you said it was 4.9 trillion every year.
Yeah.
And that's what's spent on healthcare or
Yes.
it yeah, that's
Yeah.
what's spent on healthcare. So if you divide that I divided it by 380 million. I don't know what the current
It
population of the
says
US
it's
is.
$14,570 per capita. So that's per person in a year is what they're spending per person.
Wow, okay. Yeah. So that's a lot of money. 14,000. I mean, I don't spend 14,000 a year on healthcare, but that's because I really try. It's like I think that people shouldn't have to live their lives trying not to go to the doctor unless they have no other choice. And in America, it is the thing that we do. It's a thing that I do at least. It's like I try not to go
Right.
because I know that most things that are wrong with me are probably going to turn out to be benign and not a big issue. So if I go to the doctor, I'm on the hook for a lot of money. Even being insured, even just paying copays, it's like it still feels like why am I paying all this insurance and then I also have this large copay and I'm at the doctor
And we're going to get
and
into that, why we have to deal with that. But yeah,
sure,
continue.
yeah. And so none of that makes sense to me. So I'm trying to keep my costs low and I'm trying to say like if I have a chest pain, I'm saying to myself like is this worthy of going to the doctor or is this just something that is like I can just sit and kind of wait and see what happens. And I think that if our healthcare system was better, the it might even be the other way around. Maybe people as a standard approach would contact their local doctor and get checked out just to make sure everything is good and so they can keep on trucking along. So, yeah, I think that it kind of flips the incentive upside down for how people take care of themselves and their own bodies. But yeah, those are some of the thoughts that I have on it, just hearing the numbers you're throwing at me.
Yeah, and we're both getting to the age where we have to start thinking about preventive care. So, it's, colonoscopies and prostate exams and, whatever else there is. And as you get older, obviously things you got to start worrying about things a little bit more. And there's so many more things that can get you. And it's unfortunate because, and we're going to talk about Medicare specifically in a little while, but Medicare drives me nuts because even like when my mom was going through this, um, reading some of the things that you have to like, just trying to navigate the whole system, it's ridiculous because you know that they're doing this on purpose. They're making the navigation hard. And 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 you don't really know what to do or what plan you need for Medicare or anything like that. And you've got to call somebody who's with a Medicare place and they're going to tell you all of this stuff. And they're not going to help you decide which plan to go to. They just want you to go to their plan. There's not really anybody out there that's going to help you decide which plan. You just have to fucking navigate this stuff. They take about so anybody that gets Social Security, they take Medicare out, which is about if you're not in the poor bracket, like there's a certain bracket, I think the poverty level. If you're above the poverty level, which I think in this state, which I think I don't know, I'm assuming the poverty level is the same across the country. I think it's 1,500, which I think should be higher. I think that's still a number from like pre-COVID, and obviously a lot of things have happened since then. Food prices are probably one of the worst things for people right now. But even utility bills, gas is going to go up because of the situation in Iran. A lot of shit's going to happen, and I just don't think that there's enough people focusing on it now. I know that we had the whole there was a lot of people on the side of the Republicans that wanted to just axe the whole ACA, but they didn't have any kind of plan to really do anything about it. And then I think I even heard our president saying he wanted to axe a lot of different parts of it, that he had a new plan. But then I heard that he signed on for 10 more years of subsidiaries with the plan. So I'm not even 100% sure what's going on with the ACA or if it's even, but we talked about a lot of this. And before we get into like the bulk of this, I want to talk a little bit about the big, beautiful bill last year, which made it so around probably later this year and definitely next year in every state, you're going to have to work for your health insurance. Now, I don't have a big problem with this, but my issue with this is there's going to be a lot of people that have their own issues and their own problems. And they may not be able to go to work because of mental issues or physical incapabilities. And navigating the disability system is a very difficult thing to do, and it takes a long time. So these people might just be SOL. They might just be shit out of luck. Now, obviously, they've had time to start all of this and to think about it. But here's my issue with it. You're going to have a bunch of people who are going to be uninsured. So guess where they're going to go when shit's bad? They're going to go to the ER. And if they go to the ER and then they can't pay their bill because the hospital can't turn you away, then what does that do to prices in the healthcare industry? It just brings them up, right? Everybody else has to pay for them now. So I think there's a
Yeah.
lot of things where I realize that there are people out there like, I don't think my tax money should go to this, even though I hate that. I hate that kind of thinking because taxes go for so many things and they don't even realize how many bullshit things they go for. And health insurance shouldn't be a bullshit thing in my mind. So I just kind of wanted to get that out there because I think with this big beautiful bill and with people getting off of healthcare, I think it's going to make it worse. I think it's just going to skyrocket prices for other people. And then, people aren't going to be able to get their preventive care. People are going to die. I mean, they've had an estimate of over millions of people that are going to die because of this. Is it going to be that much? I don't know. But it's quite a bit. And it does make me nervous and it makes me sad for this country because we're in 2026 and it's like we don't have this figured out yet, and it is kind of difficult. So any thoughts on that before we get into the bulk of this?
Yeah, I think it's going to get way worse. But no, it's just going to get worse. I
Okay.
have a silver lining. I actually do have a silver lining I want to put out there. I
Okay.
have we should have a segment called Brandon's Toxic Positivity, silver lining situation.
That
Here's
was
my
a
silver
long
lining
name
on,
that you should probably remember
yeah,
because I totally missed it.
TXP
Okay.
the
Right.
acronym, shorten it. So .com, preferably. Uh, So I think that, so I think that there's a silver lining here. And this is where I'm really like, I don't know what we'd say bullish on the future of AI is that I think that AI has a chance to revolutionize healthcare in a way that benefits everybody. I think that, because there are some things, I think it's some things, I don't know if we're going to talk about it today. Maybe we will. Um, but I just don't know if we'll get into it. And it's that doctors, there's like a distrust that also happens with doctors and patients. And
Came
this
out a
isn't
lot
as much
after
about the
COVID, right?
healthcare.
Like after COVID, it was a huge
Yes,
distrust. Yeah.
that's certainly true. Yeah, there's huge distrust because you don't have. I mean, I think there's a lot of there's early on there was some consensus that there's like you had people, especially with the vaccine, right? You had people that were like anti-vaxxers, and you had people that were pro-vaxxers, and then and it sort of turned into like a
Then you had
doctors
people like
versus the
probably like me and
anti-vaxxers.
you who were like, well, I
Well,
don't know.
what are we? Describe what we are in that
I
situation.
don't know, man. Like honestly, like when I start hearing both sides of those things, like I don't like first, let me just say this. Personally, I don't believe the vaccines are giving children autism. Okay. I've seen enough studies or read about enough studies to where I don't see that. I know they've cited certain studies where they've said that it has, but it's like, I don't know. And maybe I'm wrong. I could be wrong. I'm just saying personally, that's my opinion. I don't think that. Did I go out and get a COVID vaccine? No, I didn't go out and get a COVID vaccine.
Yeah.
So it's not, so it's not like I'm like pro vac, but I'm also not anti. So I'm like, I'm just kind of in the middle. And I feel like that might be where you are too. It's kind of like, I don't know. It's like if I'm 65, am I going to go get a flu vaccine? I don't know. Maybe. I mean, or, whatever the age that they start recommending those. But I don't know.
Yeah, I think that there's a lot of similarities there to how I see it too. Whereas I think that in general, vaccines have been a net positive on society. Are there individual cases where there is problematic vaccination,
Right.
parts of the industry that I think that that's probably true? I'm not real deep into is specifically which vaccines are bad for which reasons why they were bad, especially there's some historical examples I know that
Right.
exist. I think that with the COVID situation, I did not get vaccinated either. But the reasons why are very similar to yours. And this is why I'm so sympathetic. I think I'm very sympathetic to both sides, but but I understand the people who are the anti-vaxxers on this point the most, which is the freedom. And like for me, it was about putting something into my body. And I'm just so, um, yeah, I'm so hesitant to do that. Um, and so I understand why other people wouldn't want to do that either.
Yeah.
And
I get it. The thing I think about that, if I could just do a little bit of a counterpoint to that, is like that the reason why people don't want to put it in their body is because they think this way or one way, and they don't really know like which way, what's correct and what's not correct. But it is kind of crazy to me that then that same person will probably go out and drink like five-hour energy drinks in a day, and it's like, dude, do you not know what the fuck that shit's doing to your body? Like, there's so much shit
yeah,
that we don't know what's
I'm like,
doing it.
what's going into my body right now?
Right, right, right. I got some
It's like,
BK. Well, that's just soda, right? I mean, that's not so bad. But
yeah,
I mean, there is a thing where it's like we know we have to eat, and it's a bitch because we're eventually we're gonna do an episode called how do I want to call it? What do I want to call it? Probably like living poor, where we're gonna talk about like I'm sure you're not really living poor anymore. You're probably like more of a middle class, but you remember living poor. I remember living poor, and I'm kind of still living poor a little bit. But there's so much difference in living poor and then just being well off, and it's a lot more than just money. It's so much other shit, and food is one thing. It's like you can't afford to eat healthy. You can't.
yeah,
Like it's way too expensive, which is one of the reasons why I have an issue sometimes when they want to take the SNAP card and say, "Oh, only use it for healthy foods." It's like, well, okay, what healthy foods are you talking about? Because if you're talking about like the fucking $15, fish fillet that's gonna feed one person, it's like that's not feasible. It's not going to work financially. So you have to change the whole system, and that's one of the reasons why I get angry at government sometimes. Is they look at one little problem and they try to change it, but they don't ever try to change the root of it, what's actually causing all of it, and that's the big issue. Um, But we are talking about COVID a little bit, or we're talking about things since COVID. And I do want to bring up some things that happened during COVID because our system was really tested during COVID. Our hospitals were tested. Our resolve was tested. So many things that we had to deal with. And right here it says that one of the reasons why that we had a health system, because our health system did, I don't know if people know this, but our healthcare system fails all the time. But it severely failed during COVID. It really did. I just don't think that the media really actually talks about that. But the systematic weaknesses, the infrastructure, the supply chains, the human resources, that all led to widespread issues. Lack of preparedness, inconsistent guidance, and significant health disparities. A lot of people get on, who was it, Dr. Fauci. And at the beginning, he was saying wearing masks, and then he say don't. There was so many things going back and forth. Now, me
Yeah.
personally, I say, well, this is something that we're all dealing with really for the first time in all of our lives because the biggest time this ever happened before was the Spanish flu, right? Like 1918, 1919 or whatever. None of us were alive during then. Maybe there was a few people that were alive during COVID, like they were probably 100 something years old that might have had to endure that, but they wouldn't remember it. So we're all learning to try to figure this out. And it was such a big issue. And there's a lot of people that don't like Dr. Fauci. There's Our current president hates Dr. Fauci, even though he gave Dr. Fauci a medal. I don't know if people know that, but he gave Dr. Fauci a medal, and then later he got rid of his Secret Service protection and then said that he should be charged. Um, it's just really weird how it is, how we've got to this point, and to where I know people have been sounding the alarm for a long time, but it feels like even though we've been sounding the alarm, it just keeps getting worse. It's like, it's like we just, the
Yeah.
alarm, our ears drowned it out, and we're like, oh, it's kind of like school shootings. It just becomes the norm. And it's really sad and pathetic because you're like, oh, another school shooting. Oh, another day in America, and it's
Yeah.
just, it's sad that that's how to happen. But yeah, COVID really fucked up supply chains. It really screwed up a lot of shit. The biggest thing was when people needed the respirators and there wasn't enough to go around. And a lot of people died. But we have over 1 million people die. Now people argue about those facts about, oh, did they actually die from COVID and stuff like that. So I don't know,
Well,
but
I thought it was mostly, am I wrong? But I thought it was mostly factual now that the respirator treatment that was used during the early days of COVID is now known to be not the right course anymore because
oh, I
it
don't
did
know.
lead.
I don't. You might be right. Yeah. I mean,
Yeah,
there was
I think
certainly.
now they resort to supplemental oxygen because they
Gotcha.
found, because the respirator treatment was a standard practice
Have you
that
been
they
watching
would
Dr.
use.
Mike?
Dr. Mike,
Yeah.
I don't, yeah, maybe, is that the handsome doctor
That's
who's,
the handsome doctor guy that's always on.
yeah,
I love Dr.
yeah.
Mike. He's good. He's good.
No, so from what I understand, that it was a standard treatment practice for people who were having trouble breathing, where their blood oxygen levels fell to a certain point. It was like you're following the checklist, and it's like the next point in the checklist is put this person on some sort of respiration, like manual, like breathing device.
Right.
Um, but the actual physical, like what was going on in their lungs was actually a little bit different than the standard profile of people you typically put on these machines. And COVID was causing a situation where you weren't not, am I saying that right? You were not getting good oxygenation into the blood, for other reasons. And so they realized later that it was often much better just to put these people on supplemental oxygen, and allow that into the blood. So it's like, um, fact check me if I'm wrong, but I'm pretty sure that was one of those things where it was like, it sounded like one of those conspiracy theories that turned out to actually have a little bit of merit to it, where it was like, in some hospitals, they were probably even, some people needed, it's funny because some people needed respirators. They didn't have it available, but then some people were put on respirators and died. And later on, there's some medical professionals that say like it's possible that some of those people could have lived if they were just put on oxygen and not immediately put on a respirator because of what it did to their lungs. So that's another example too, of something, because I feel like I've seen more and more of this lately, where something starts off as a conspiracy, and I'm generally believe it or not, I'm generally the type of person where I don't immediately believe conspiracy theories, where I'm like,
Yeah.
I don't, because I don't want to fall down the rabbit hole. I want to try to live in is mostly positivity, thinking that most people are straight shooters and most humans are good and we're all trying to get through. And then there's these conspiracies that come out and I don't believe them at first, but then over time, it's like, especially with COVID, there's like, you can't throw all babies out with all bathwaters now all of a sudden because there's like a certain percentage of things that like are kind of true. You know, if you cherry pick these things, they're true. Maybe the respirator thing, maybe not. Maybe some other aspects too. Like the masks is like when, you know, at first like wear the mask and you get these people saying like masks don't work. And then you actually have the, you know, and then you have Fauci saying that doesn't work. And now it's like the certain subset of society, which is like the conspiratorial, now feels vindicated on that one point, and you don't want them to take that and like run away forever with it and be like, now everything's true, but it does add distrust. And I think it's happening, and this isn't just healthcare related, but for example, like Epstein is a good example where
The
it's like,
Epstein file. I was
how,
going to mention
how
those.
many
Yeah.
how many Pizzagate conspiracies have I heard? And now the
Yep.
more I read about the
It's
files,
crazy
I'm
you
like,
said that. I was going to talk exactly about that. And it's like, and you know, and honestly, the Pizzagate conspiracy was all about the Democrats, if you remember. It was all about Hillary Clinton knows about this pizza place. And then it's like, now you're reading it and it's like, well, it looks like it's just the elites we're talking about. It's like they're all part of it. Whether it doesn't matter, it's not partisan anymore. It's the elites. And
yeah.
it's insane.
Yeah, it's a class. It's definitely a classist, like a class separation. Something's going on, but it's gotten me to the point where I just can't immediately distrust conspiracies based on the source even anymore. Like
Right.
no matter how crazy, right, left, or the type of person, or rich or poor, it's like I have to sort of say, like when I hear a conspiracy, I'm like, that might be true. Like
Right.
that's where I'm at now. It might be true.
Except for flat Earth, right?
I don't believe in flat Earth, but you know what? I don't. I At this point, I
You don't
guess it's
know.
possible.
They're
It's
just
like
all, yeah.
I don't know. I'll give it a 5% chance this Earth's flat.
It's
I'll
a,
give it.
it's a, what do
I'll
they
give it
call
five. Yeah.
those that you had to make in science class? It's a diorama that's just like above us. It's like with giant
Yeah.
fake
It's like
planets
above
and
us.
shit.
Yeah.
Yeah, we never touched the moon. Yeah, I mean, I would have that one is probably the one that would be the lowest on my list of actually believing. But yeah, I do get you. Like, there are some things coming out, and you're like, the whole Pizzagate thing was crazy, right? Because you're like, because everybody's like, QAnon is fucking crazy, and you're like, holy shit, QAnon knew some shit, you know. And you know, and there's conspiracies around Epstein's death. I know we're kind of not really talking about healthcare right now, but you know, I've read
Go
recently
off.
where I've read recently
It's crazy.
with oh, go ahead. I feel like you got
Well,
something important to say. Go
well,
ahead.
I was just saying. I read something the other day. It said that there was inmates or something, or an inmate that at the same prison center that or wherever Epstein was being held,
Yeah,
and they had overheard, I guess, guards arguing or there was a commotion where.
I saw a headline for that. Yeah,
Yeah, and they had like they had like their written statement of like what they heard, right? This prisoner had overheard this conversation,
right.
and it was basically them talking about how that they had to cover up what happened. And it's like, why would guards even have to be talking about covering something up if he committed suicide and
Right.
that's what we all think he did. Obviously, there wasn't a cover up or they thought they had to cover up a suicide, but that doesn't make any sense. So yeah, so that's another point of distrust about that situation. It's like, I don't know what's going on.
You know, the big problem with all of the Epstein thing is I feel like there's half of the country who's like, well, maybe not half, but I do feel like there's a lot of people that don't believe it, that just believe that like, or maybe they just believe Epstein like acted alone and there wasn't any of these, like maybe they don't believe Clinton was involved, or they don't believe Donald Trump was involved, or they don't believe, you know, whoever was involved. They just think it was like Ghislaine Maxwell and Jeffrey Epstein. And then there's a bunch of us who are probably like me and you who I read stuff and I'm like, do these people really think that we're all that stupid? Like, do they really think that we're all going to be like, oh yeah, nothing to see here? They've already talked about how they're going to like who was it? I know it might have been Christy Nome. Maybe it was Pam Bondi. I know Christy Nome just got like demoted or something. But Pam Bondi, I think it might have been her who was saying that like, okay, or maybe it was Kash Patel who said, um, it's over. Like the investigation is over, and everybody's like, okay, so everybody just gets a pass. Like they're arresting people in other places of the world, but they're
Yeah,
not arresting anybody here, and that's
it's
just
not
kind of
over.
fucked up to me. But
Yeah.
two things let's get back into healthcare. Two things I want to talk about really quick about COVID. I want to talk about number one, the biggest thing. I want to talk a little bit about the whole ventilators thing because I didn't hear that, but I did, but I don't. It's not. I wouldn't like not believe it. I had a friend. Well, it was a friend that I knew many years ago. She was just kind of like a Facebook friend. She was a teacher and she had a husband, and her husband was like my age. Maybe close, probably in between our ages. And he was a little bit overweight, but not anything crazy. And COVID took him down. He had a ventilator, and he was down for like 2 months and then died. And I think and that's one of the important things I want to note about COVID is I think that was why it was so scary is because usually when these things come out, we're like, okay, the kids and the old people, let's protect them. But it was taking people down like us, right? It was taking people down like our age who didn't really there wasn't anything in our backgrounds or our medical, anatomy or whatever that was saying, oh, this is why they're doing it. There
Yeah.
wasn't anything like that, and that was scary. Also, there was a big ripple effect, and this definitely happened with me, is there was a lot of people that didn't want to go to the doctors or the hospital during COVID for other things. So all these different diseases that were building up with people that didn't want to go because maybe they didn't want to get infected or they realized that they were overwhelmed already. Um, how many of those people had issues? Like how many that like caused like long-term issues just after that, like where maybe they didn't go to a doctor until like 2 years later, and they're like, "Oh, you probably should have came here earlier." And it's like, "Well, what do you want me to do here?"
Yeah.
So I feel like there was a lot of that, and then obviously the mental health that strained a lot of people. And then there are the vaccines where they have a kind of a like I know I had a cousin on my stepdad's side who got it and he passed out, but he had a specific gene that was making him pass out, and they knew that. But I don't know exactly what happened. So he was freaked out about it, but then he realized, oh, this is just people with this gene have this, and then he was fine. But then I know there's people that are going to have, but then there's long COVID effect where people are having lung issues and heart issues from having COVID once. So it was just such a fucking thing that we had no idea what we were dealing with. And I don't think we still know much about it. I'm still getting half and half about where it came from. There's people saying, oh, it was definitely a lab leak. And there's those people
Yeah.
saying, oh, it's definitely the wet market. And so it's like, I don't know, it's so crazy. But let's get back to healthcare a little bit and let's talk about insurance, because insurance is the middleman in healthcare. And this is where whenever you hear middleman, it's like, we don't need it.
Really. Yeah, it's
You
really
don't.
good.
It's just you hear middleman and you're like, oh, that's why prices are the way they are, right? Because same thing when you go to the store. Like you're not going to the wholesale warehouse where these stores are buying the food. You're going to the grocery store where they had to buy the food from the wholesale warehouse, where they had to go buy the food from a farmer or wherever they're getting it, or whatever it was. And so that's why food is way up. And that's why when people used to go to Save-A-Lot or Aldi, where they would get some of that stuff direct from the warehouses or things like that, or maybe it would just fall off the truck, and then the big
Yeah.
stores wouldn't take it, so they gave it to like Save-A-Lot or Aldi or whatever. But so the insurance is a huge thing, and I think I want people to think of, it's a like auto insurance, right? Like if you get into a car accident, we're a no fault state. And I think there's a few out there in the country. But if you get into a car accident or something, you have to deal with your insurance company, and then you have to go and find a mechanic, and then the mechanic says this is the price, and then you give that to the insurance company, and the insurance company's like either yes or no, or okay, we'll pay this, but you got to pay this much. So it's not much different than that. Um, Private insurers sit between patients and providers, adding administrative overhead and consume an estimated 30% of healthcare spending. So because we have private insurers and they're, you know, negotiating between the patient and the doctors or whatever, that's adding 30% to healthcare spending, which is that's insane to me. It's insane. Insurers profit by collecting premiums and denying or delaying claims. I've read plenty of stories about people who have had long-term illnesses or fatal illnesses, and insurances are denying their claims. I believe that's what happened to Luigi's dad or somebody in his family, and that's why he shot down a CEO of the healthcare. I forgot which place it was, but um,
United.
yeah, and so you hear about this, and I don't want to say that that justifies murder. Don't go shoot a CEO of a healthcare insurance company or whatever. But you can understand why people are frustrated, and
Yeah.
it's just too sad that, like, it's really sad in this country that we let our people die. And we're going to talk about avoidable deaths at one point in this podcast, and that's basically. And by the way, I'll just say it right now: we lead the entire world in avoidable deaths, which is a sad thing to think about. Um, okay, so then, obviously with insurance, you have to worry about prior authorization requirements, force doctors to get insurer approval before treating patients, often delaying care. Employer-tied insurance means losing your job, losing your coverage, leaving millions uninsured. We talked about earlier how 61% of the people insured in this country are through their employer, which to me is crazy. That's a lot. Um, and then the ACA, the Affordable Care Act, or Obamacare, whatever, however you want to call it, created exchanges, but insurers still set the rules, so they just had to follow them slightly more. I want to talk about how hospitals set the prices and they inflate the system. Hospitals inflate their gross prices to begin with, and insurance companies help design those inflated prices, then turn around and claim they're saving you money through discounts they negotiated. The discounts, they vary widely. Sometimes 0%, sometimes 95%. And it all depends on your specific plan, the hospital location, and the service. And this is why hospital staff can't tell you upfront what something will cost, because at one hospital it could be $5,000 with your insurance, and another hospital it could be $500 with your insurance. And without insurance, patients are exposed to the full inflated gross charges, effectively coercing people into buying insurance. So we talked about this at one point. We had talked about healthcare, and we talked about how if you are uninsured, you're getting the full fucking price, a price that's ridiculous, because what the hospitals and all these doctors are trying to do is they're trying to say, hey, go get insurance because we've worked out a deal with them. And they're making you have to do it. And it's insane to me. So out of all the
Yeah.
stuff I just said, I've been talking a lot. I want to get your advice on some things. Um, what do you have to say just about healthcare and health insurance in general? Because it really does feel like it's kind of fucked up, doesn't it?
Yeah, I'm not sure if I even can add.
Yes, sorry. I
I
did a little
don't.
more research than normal for this one, so I have a lot. I have a lot of information down.
It's really messed up. I almost want to go through almost one by one on some of these bullet points because it's so like, okay, the same procedure can cost $500 in one hospital and $15,000 another one across town. These kind of discrepancies are, yeah, Matt, I don't know what to say. The insurance industry, here's how I generally think about insurance. Okay. I think that like, if like auto insurance, I wish I didn't have to have auto insurance actually. I don't like that it's a law. I understand why it is a law
Yeah.
because it's liability for if you hit somebody else, especially in the states where your insurance
Right, because
covers
it's no
their
fault.
vehicle.
Like, it's actually, I think it's actually not really benefiting us that this is a no fault state. I'm not 100% sure,
Yeah.
100% sure on the pros and cons of no fault, but I don't think it's really good for us. I think it keeps our insurance rates higher than they
Yeah.
should be.
Yeah, and just for reference, that's here in Michigan. I think how, and I could even have this wrong, but I think how the no fault part of it works is that it doesn't matter who's at fault. Your
Right.
insurance covers you, and their insurance covers them.
Right.
It's not. I think in some states it's like if you're the one at fault in the accident, then your insurance is the one that either covers maybe everybody or some situation like that.
Right.
So but generally, how I think of insurance is that I prefer not to have it. I almost rather take the risk because I know that insurance companies are for profit. And so what they're doing is they're weighing the odds. And on average, they're making money because they're collecting more money than the payouts. And so my reasoning is I'd rather just take the risk and take that money and not pay them and instead put that money in my own pocket and then and just take the risk. And when I do need it, then I will have that money saved up for myself. And the cost of services should cost me the same as it does for the insurance company. And so if
Yeah.
I get to save that money and I use it, and I think for other insurance situations, like for auto, it is the same. That's the point I'm getting to with healthcare. So like if I go to a mechanic and whether an insurer is paying for it or I am, it's like the same amount. Uh, so if I have that money saved up into a bank account, because I didn't pay insurance for the last 10 years and now I got way more money because it's like I get my own profit now. And so I'm paying for my own auto repairs, plus I have money left over. Um, in healthcare, it's not like that. And that is actually the biggest like crony healthcare system that I see is that how come I can't pay for it and have the same negotiated cheap rates that the insurance companies pay for it? Um, yeah, and I don't know all the ins and outs of that, admittedly, but I do know enough to know that there's something wrong with that system, and there's the incentive structure is backwards, and it should benefit people in a way to where if I didn't have health insurance and I instead just put that money into my bank account, that I should still be able to pay and afford my services the same way the insurance company would have to.
Totally agree. Totally agree. And I want to say that the key mechanism um, is called, well, they call it insurance adjustments, but they mainly call it contractual allowance. Um, so before each calendar year, insurance companies negotiate with hospitals to get discounted rates, often 60 to 70% of the hospital's standard gross prices, in exchange for directing their subscribers to their hospitals. So this is all just, they're all working in cahoots to basically to fuck us, basically. I mean, they just want money. It's all about money. And we live in an area where our hospital has taken over everything. It's like all the healthcare, like every facility. So they've already got their monopoly on this area because it's like what can you do? I think even there's a city that's probably about half hour, 45 minutes south of us, and I think they're even. I don't know for sure, but I think they used to be one different hospital, but I think our hospital in our city bought them out too. So it's like what it, it's just it's so crazy to me. It's just so crazy to me. And let me say, first of all, I want to talk about this. The middle class bears the brunt as the system's primary funding source, while hospitals' insurers profit from the arrangement. I want to note that the middle class, out of people talk about taxes all the time, the most taxed people in this country are the middle class. They're the highest taxed people. So that's kind of important to know too. Oh, and middle class, if people want to know, is making, because I had to look this up because I didn't really know what the annual wages, like what they consider middle class, $40,000 to $120,000 a year, which is kind of it's a pretty big gap. So those people making that amount are in the middle class, and they're bearing the brunt of a lot of this stuff. Politicians benefit twice from healthcare lobbying dollars, which is the largest lobbying sector out of all of them, and from political capital gained by announcing historic negotiations that are actually just standard industry discounting prices. So this whole time, every time one of these one of these politicians say that they've negotiated prices, they're fucking lying. They've already been negotiated. They're just taking the credit for it. And so it's really crazy to me. And I didn't know that. I didn't really know much about that. So what do you say about that? Because
Sounds
they're
great.
benefiting too. I mean, it's all lobbyists. Obviously, we could talk about lobbyists all day long. I hate lobbyists because all they do is they're there to make people money, and they get paid. Lobbyists get paid higher than middle class. I'll tell you that.
Yeah. Um, well, to take a step back too, on the point you made just before that about the middle class bearing the brunt of the healthcare costs, I I can see that because I'm middle class now, and I for most of my life I've been lower class and grew up in poverty,
You saw
and
your taxes spike up there, did you?
I saw my taxes spike up there,
Mm.
and I also see that I also see the problem with squeezing everything out of the middle class because I think it destroys upward mobility, which is one of the cornerstones, I think, of what is like the thing that that can separate America from other countries is this idea of upward mobility, is that you can start from the bottom and through sheer work ethic, you can work your way up to the top. And this like sort of squeezing of the middle class, it makes this ladder that you have to climb feel like it's infinitely long and it's never going to go anywhere.
Yeah.
So
It's like
it's
Donkey
really
Kong. It's like he's at the top and he's just throwing. What does he throw? Boulders? He's just
barrels,
barrels. He's just throwing those
barrels.
barrels at you, and you're like, "Fuck,
Yeah.
fuck! I gotta keep jumping."
Yeah, right. And you keep jumping. And every year that goes by and as more tax laws get passed, it just feels like there's more and more levels. If you remember Donkey Kong, it was like he's at the top and there's like these levels that are like kind of set at like diagonals. So the barrels roll down, level to level.
Yeah,
And
yeah,
it's like it just feels like they keep adding more levels.
yeah.
Like as you are climbing this thing.
Right. You think
And
you're almost there, and nope.
and you're not, and you're really far away.
Yeah.
It reminds me of this idea. This might be kind of abstract, but it reminds me of this idea that I read about. I was watching a video on space travel and about how there's certain parts of space that humanity will just never get to. Like science says, we'll never reach this part of space. And it's not because of how long it would take us to get there. It's because it's actually just impossible to travel there because the expansion of space is happening at a rate at that point where it will surpass the speed of light. So
Mm.
even if you could travel at the speed of light, you still can't reach these parts of space. And so it's like, so that's what it reminds me of, is this class divide and the squeezing with the taxation and the
Yeah.
healthcare, being thrown onto the backs of like of the people in the middle class. It reminds me of this infinite expanding like universe where even if you work as hard as what the equivalent of the speed of light is, you're still never going to reach certain parts of space. Like it's like it just feels like the Elon Musk part of space, it becomes more and more out of reach.
Right.
And
Right.
that is a big issue as well.
Yeah. I want to go to the big red spot on Jupiter and die because that's probably all that would happen.
And just hang out. It'd be cool to
Isn't it
bring
bigger
like
than Earth? Isn't it? Isn't that spot bigger
yeah, I
than
think
Earth?
there's like, I thought it was like 13 Earths can fit
Yeah.
in
Isn't that
in the
insane?
eye, something like that.
And it's just a constant fucking storm. And I think I remember reading like the wind speeds, and I'm like, oh my god, like this is nothing we've ever experienced on Earth. It's fucking crazy. We should do a space episode, maybe. That probably
That's a really great idea. Write that down. Actually, I'm really interested in that.
space.
I'm really let's do that.
Spaced out space. All right. Let's talk a little. Okay, so we talked a little bit about the hospitals. I want to say that Joe Biden, he signed into a law where there was a price transparency rule where you had to like, it's been technically required since 2021 in this transparency where the hospitals are supposed to like tell you about certain prices, but it's widely ignored and just buried in an unusable data format. So it's just they find ways to get around this shit. Nonprofit, let me quote this, nonprofit hospitals often generate massive surpluses while paying executives millions and charging patients aggressively. Honestly, dude, when people start talking to me about nonprofits, I'm like, I don't even know why they call them that. For the most part, there are nonprofits out there that do a good job, but I think there are ones out there that they're making a massive profit, and it's like, why are you even called this? Yeah. So in the 2003 Medicare Modernization Act explicitly banned Medicare from negotiating drug prices. So this was a gift written by and for pharma lobbyists. So in 2003, they passed this. And the ACA negotiations involved back channel deals with hospital lobbies and insurers before the public debate even began. So even before they passed the Affordable Care Act in that was like 2011, 2012, whatever that was, they knew that it was that was getting to that point, and so they were already negotiating shit before that. Already, the ACA was kind of, I mean, it has helped more people, I do think, but for the most part, it didn't do what we want it to do, which is get rid of this bullshit, right? And I don't think it's ever going to do that because we know politicians are making money off it. We know lobbyists are making money off it. CEOs of drug companies, the people who are in the hospital, like everybody is making bank off of this shit. And so it's really crazy to me that it's still like this. It's a revolving door. So former insurance pharma executives become regulators. and then former regulators become industrial lobbyists. So they just fucking go, they just move around, and they're all doing the same thing. They're all making mucho bucks. Campaign finance means the politicians writing healthcare law are often funded by the very industries that they're supposed to regulate. So why would they campaign against, like, we that's another thing we should talk about at one point, is how politicians promise certain things, but then they get all this money from just a small group of people, and it's like, well, who are they really working for? I mean, those people didn't just give you the money out of the goodness of their hearts. So, and then bipartisan healthcare deals often protect incumbent systems rather than restructure them. I don't know, man. Like, anything more to say? Like, I mean, there's still more we're rolling through here, but do you have anything to say about any of that?
No, but I don't agree with lobbying.
Yeah, I hate lobbying. I
Um,
really hate it. Like, it's it's insane to me. And that's why, like, we had talked about on our marijuana episode about it being legal, like, federally. I was like, that would be one of the things where I would hate, is it then you're going to have lobbyists just like tobacco, and then that means they're paying their. I think weed prices would go up if it was federally regulated. And maybe it goes back to how it was when you had to find your back alley deals before it was legalized. I don't know, but that concerns me if we were to do that too. Um, so we need to make contractual allowance illegal. Is what we do. Is what we need to do. That's the way to fix this. Now, I just said why they're not going to do that. Everybody's making money off this. Politicians, everybody. There's so many people in between there that are making money off this. But that would require hospitals to charge the same price for every patient. That seems logical, right, Brandon? That seems logical, and it makes sense to me. Um, Whether they're paying out of pocket through private insurance, Medicare or Medicaid, one service, one price is what it would be. Hospitals would no longer be able to automatically discount bills based on insurance contacts. They could still write off bills for those who can't pay, or charity care. So apparently hospitals get charity care, and then they get money from the government for these people that do go to the ER or whatever, and they can't afford their hospital bills. But secret pre-negotiated discounts for insurers would be banned too. So any of those pre-negotiated discounts that they do every year, that would be banned as well. And then insurance companies would pressure hospitals to lower their prices, but this time hospitals couldn't offer secret discounts, so they'd have to actually lower their listed gross prices to stay in network. Hospitals that refuse would lose all of their revenue. Network restrictions would collapse in practice because fair pricing would no longer justify them. This means also, because we didn't really discuss this also means that rural hospitals who could just charge whatever the fuck they wanted because nobody's going to drive. Well, first of all, if you have an ambulance taking you, you don't even have a choice, right? They're just taking you to the closest hospital.
yeah.
So, insurance would shift back to its original purpose, which would be protecting against financial catastrophe rather than serving as a required middleman just to access fair pricing. Let's talk about winners and losers. Patients win with real price transparency and meaningful choice. Independent doctors win as small practices become more viable. We just talked about how our hospital in our area has taken over everything. Medicaid deals with our hospital. So if you have Medicaid, Medicare as well. If you have Medicaid and Medicare, you have to go through doctors that are under that umbrella of that hospital. That means independent doctors are losing out. They either have to, it's just like a small business. They either have to join the big boys if they're not making it, or they just have to rough it and then maybe fail. Insurance companies would be the biggest losers since their primary value proposition today is providing access to secret pricing, not actual risk pooling. And then hospitals would be forced to compete on price, quality, and efficiency for the first time in decades. So what do you think about getting rid of, what did they call it? The contractual allowance, which would be, they wouldn't be able to set these prices. The hospital would be able to charge everybody the same price. Like, that seems like a fair deal, right?
I think so. Let's just touch on that one more time. The contractual allowance says that different hospitals have to charge everybody the same price for the same services.
What it does? Well, the contractual allowance is the insurance companies negotiate with hospitals to get discounted rates, often 60 to 70% of those standard gross prices in exchange for directing their subscribers to those hospitals. So if you, and that's what makes it, sometimes the discount is 0%, sometimes the discount is 95%. They're all doing that prehand. So if you get rid of that contractual allowance, it stops that. It also stops lobbyists.
Yeah. Yeah, in theory, that sounds good. Yeah.
Yeah, everything does. Yeah, a lot of things do sound good in theory. You just don't know. I will say,
It's an experiment worth trying at least,
oh
though.
yeah,
Yeah.
there's so many things that we should be at least trying. I think the worst thing to think in those situations with certain things that happen in this country is that a lot of people will be like, "Nah, it is what it is. Can't do nothing about it." And it's like, no, you can. You just don't want, like, people don't want to do it.
Yeah.
This benefits both sides as far as partisan issues. For conservatives, banning contractual allowance requires minimal government involvement. That's often what conservatives want, which means so no price controls, no mandates, no government spending, just a requirement that businesses charge everyone the same price for the same service, which also aligns with, free market principles, which I think conservatives are big on. For liberals, it directly addresses price gouging of the uninsured and dismantles local hospital monopolies, which we just talked about, how we are living in a hospital monopoly in a city with one,
Yeah.
as it says. The medical industrial complex is the largest lobbying sector in the U.S., and politicians also gain political capital by claiming to negotiate better rates, theater that would be unnecessary if prices were transparent. So this is why politicians wouldn't want to do it on either side. And then monopolies. Monopolies operating in the modern economy, unlike the obvious monopolies of the 19th century, modern ones work by creating environments where they become the only practical provider. And we just talked about that. Sports venues do this. Digital ecosystems. Think about Apple. You got to get all Apple stuff, right? So they're, Android obviously does this too.
Yeah.
But it's all like that identity branding. They even mentioned Tesla. How, if you remember right, they were trying to make sure to get people to only buy American cars. And I believe that Tesla, I don't know if every single part of America or of Tesla is made in America, but it was going to be the closest thing to an American car, because no cars now, even if they're produced in America, no car is 100% American because they're getting parts from all over the world and stuff.
Yeah.
So yeah, that's kind of another thing.
There's an interesting tax allowance that I saw this year when I was doing my taxes about how if your car was, I think it was like a new car that was financed anytime during the last year, and then you paid on that you got like a tax break on that. But the car had to be majority American made.
Yeah. Do
So
you
I
have
see
a
that
Do you have a majority American made car? What do you drive again? Oh, you drive a Jeep.
I do. Yeah, I drive
Yeah.
a Jeep, which is a majority. It does qualify as American made.
So you got. Let me ask you a question. You don't have to say how much of any of either way, but are you getting money back, or do you have to pay in money, or don't you know
Oh,
yet?
I have to pay in money.
Okay.
No, I already know. I did my taxes and I had to pay in. It's for what it was and the over under on it. I was fairly close to breaking even, actually.
Okay. And you're okay with that, or?
Yeah, I'm okay with that. I mean, all things considered, yeah, it was fine.
Gotcha. All right. Well, while we're on it, or while we're on a little mid break here, since we're kind of depressed about all this healthcare stuff, we should probably do some.
It's time for our fake sponsors.
We are fake sponsored by Diet Sugar, the tasteless imposter trying to fool us all. We know you're not real sugar, and that pisses us off. Stop being fake and embrace what you are, a devious fraudster with mischievous goals. Diet Sugar, making you think twice about dieting. From acclaimed television producer Dick Fox comes a new animated series this summer. 3 Russian squirrels are turned into war soldiers after Vladimir Putin goes mad over a missing fur coat. But when the teenage squirrels become self-aware, they do all they can to take down the evil that made them into the Teenage Putin Ninja Squirrels. Streaming this summer on Bushka. All right. How do you like that? Good stuff.
Bushka's good. They have a nice selection. I knew that's where you were going.
Did you?
Teenage.
Yeah.
Well, I was thinking of Teenage Mutant
Right,
Ninja
but then you're
Squirrels. I
like,
thought you
okay,
were just
putin,
yeah.
putin. Not much that
Yeah.
rhymes with mutant, even though it's technically mutant. But most people don't pronounce the T, do they? We just kind of say mutant when we say Teenage Mutant Ninja Turtles.
Yeah, I guess so.
Yeah.
Mutant.
We
Yeah,
don't, we're
mutant.
Americans. We shorten everything up. We make everything easy as can be. Well, it's sometimes we make it harder, like healthcare.
Yeah.
Ding ding. Let's talk about Medicare and Medicaid. I already talked about the difficulties of navigating the system. And I know most insurance relies on the referral system, and what I mean by that is you got to go to your PCP, your primary care provider, and you got to say, "This is what's wrong with
Is
me."
that what
Blah
that
blah
is?
blah. Yeah, yeah. Primary. Yeah, it's weird to say that it's that, right? Primary care provider. They should probably. I don't know. Yeah, don't take PCP. Go to a PCP is what I'm trying to tell people. If you take it, you'll definitely probably have to go to your primary. Well, probably skip the primary. You won't need a referral then. But
Or you might just fix what's broken.
oh,
It
maybe
depends
you
on
never know.
what's wrong
Or
with you.
like
Yeah.
they're saying a lot about microdosing now too. And I'm getting interested in that. I'm like, there seems to be a lot of benefits to microdosing. Um, but yeah, the referral system just means you got to go to your primary first, and then you say blah blah blah, and then if they think that, like, let's say you've got something going on in your throat or your mouth or your nose, then they're like, okay, well, I'll refer you to an ENT, or if you've got something going on with your heart, they'll refer you to a cardiologist, or so you've got to go through the system, and it takes a long time because, like we had said before, with the Medicaid and Medicare system, they're all just under the same umbrella of doctors, and we have that monopoly that we're dealing with, so we only can see what they tell us to see. Now, I'm not afraid to admit this because I'm a poor man right now. I am currently on Medicaid, and my Medicaid, it's one of the biggest things I get mad at is there are so many people who think that the people on Medicaid are, I don't want to say like defrauding the system, but they think that they're the reason why everybody else has to pay more in taxes and all that. And I'm going to tell you right now, the people that are defrauding the system aren't the patients that are on Medicaid. It's the fucking doctors and the hospital, not necessarily the doctors, but it's what we just talked about. They're setting all that up. And Medicaid is kind of like a cash cow for these people, because what happens is they'll say, oh, okay, you go in for one thing, and they're like, all right, well, we want to check up with you in 3 months. And then you go back up in 3 months. It's the same shit. We want to check up with you for 3 months. And then they have deals with other people. They'll say, oh, hey, I have degenerative disc disease in my neck, and they put me in was physical therapy. And I'm already negative going into this thing, right? I'm like, well, first of all, I don't move my neck around that much as it is because it hurts to turn every way with my neck, up, down, left, right, whatever it is, on a swivel, whatever it is, it hurts. And so I sit there and I'm like, well, this is a degenerative disc disease. I mean, what is physical therapy going to do for me? And that's how I think. And maybe it might help a little bit. I don't know. But ultimately, the word degenerative is not a good thing, right? It's just going to keep happening. It's going to continue degenerating. And so it's like, to me, and when they were setting up these appointments for me at the physical therapy, like they literally set up like 10 at the beginning, and they're like, oh, this day, this day, this day. I went to the first one and I could not go back for 2 fucking weeks. I was in that much pain. But this is what you have to do. And you have to do this because Medicaid won't let you do anything else. They say, okay, do this for 20, 30 times. And then if that don't work, we'll send you to, I don't know what it would be. It would be some kind of doctor, whether it be a neurologist. I'm not really sure who it would be, because then they talk about surgery. Oh, well, then we'll maybe do surgery. Why do you call it degenerative disc disease if there's a way it can be generative again? Right? I don't think surgery is going to fix the generation. And then, you have surgery, and that could lead to more problems. And by the way, this DDD, I don't think there's only one other person in our family that has it, and it's our aunt. And so I'm kind of like, oh God, like that sucks. So I don't know if that's
Yeah.
just like a thing that's kind of been passed down or whatever. But I did want to say that there's a lot of people out there that look down on the people on Medicaid. And I'm here to tell you that being in the system, and you've been in the system before, you were on Medicaid at one point in your life, and maybe you feel the same way. It's not us, it's the system.
Yeah. Yeah, I agree. The people on Medicaid are not the ones I mean, like, the people on Medicaid are getting the lowest tier of barely qualified service many times as well. Especially because it crosses over into things like, that's where you get dental coverage too, right? When you're on Medicaid, you're basically getting it through Medicaid. Is that right?
Yeah, you can't get much now, though. Well, first of all,
Yeah.
on Medicare, your dental coverage is awful and you've got like a high deductible. On Medicaid, you don't really have to worry about deductibles. I think I get maybe $1,200 a year, which isn't bad when you think about it, but I have bad teeth and I need every one of them pulled, and that wouldn't even do it. Uh,
Yeah, well, and beyond that too, it's like the quality of medical care you're getting from
right.
people who accept Medicaid that are dentists it's a crapshoot.
It
I'm going to be
is.
honest. There's some really great doctors,
Right.
dentists, and then there's some really great. I don't know why I had to correct. I mean, dentists are doctors. I
Right.
don't mean to
Yeah.
like,
Oh, you're an
you know,
anti-dentite.
yeah.
Brandon's an anti-dentite.
Oh no. Um, and I've seen this firsthand too, where the level of psychological
Yeah.
um help is the quality is a
I
big
was about
difference
to get
between
into that. Yeah. Yeah.
yeah, there is a big difference. And I've seen that difference firsthand. And I've been in a position to be able to contrast and compare even with Medicaid accepted psychologists and like somebody from like betterhelp.com, and the BetterHelp was better. And BetterHelp gets its own bad rap for being sort of a crapshoot for this kind of help for people, because you can get good ones and bad ones. Um, yeah, but it's really it sucks, and I agree that I would not jump to blame the people that are on Medicaid as the problem.
Yeah, and I think I talked to you about this off camera at one point where I said that about 6, 7 months ago, I called a place around our area that's a community health mental health center. And I did like a little 15-minute, whatever it is, like a little, what would you call it? Like a screening, I guess, like over the phone. And after those 15 minutes, they said, because I wanted to see a psychiatrist or a therapist. I didn't care at that time. And they said, "Well, you don't fit the bill, or you didn't pass the screening." I don't know what, like I wasn't worse enough. Basically, is what they're saying. That you aren't quite
Yeah.
worse off yet. And then I told you that a few weeks ago I had an appointment with my primary. By the way, when in Medicaid, your primaries are not doctors; they're nurse practitioners. Most 90% of the people see nurses; they don't see doctors at all. Um, and she said, I said, "Well, hey, can I get a referral to see a psychiatrist?" And she said, "Yeah, the only place I can refer you to is the very place that I called 6 months ago." And I was like, what the fuck is this? Like, this is insane to me. And by the way, that appointment was 2 weeks ago that I had with her, and I still haven't heard anything from this mental health community, which I'm sure because they're the only one that Medicaid has, they are fucking backed up through the roof, I'm sure. And that's
Yeah.
another issue, is just a lack of people, a lack of, like you said, a lack of, enough doctors or whatever to deal with the general public. And so that really pisses me off. I also want to say, I want to talk about hospitals again for a second, because I want to talk about two instances where doctors actually caused hospital bills for both of my parents, for my stepdad and my mom. For my mom, when she had cancer, she had one of the things she was taking I always suck at this word, immunotherapy drug. Oh, that's not bad. Um, because she had a special gene. And so she was taking this immunotherapy drug. I'm not saying it again. Um, and I mean, it's like an O in there. I don't know. It's
Immuno.
therapy. That's bad. That's good. That's good. All right. Good way. Oh yeah, you're gonna be my grammar teacher from now on. But yeah, so her doctor prescribed her these pills that were supposed to work, but we're kind of mad because she had a what do you call those? Lymph nodes. There you go. She had one by her heart. And to this day, this is how we think that she passed, is that she had a heart attack. The cancer wasn't enough to where it would kill her yet. And I think this is what happened. But there was one really close to the heart that they were worried about. But they kept putting off. They just kept telling her to take the pills, take the pills, take the pills. They're just like, no, the pills, keep taking the pills, which kind of pissed me off because the doctor told us that, or told her that she was the first patient, because this therapy drug was approved in 2020 by the FDA. So it's pretty new. And she was the first patient of his. So we kind of felt like it was like a guinea pig situation where he's like, oh, I just want to see if it's going to work. And why not? Let's do it on the people who have Medicaid and Medicare because we don't give a shit about the poor people. Well, one time she had trouble breathing and she called the doctor's office and the nurse told her, well, go to the hospital. And she had already been to the hospital like twice in that week. She went to the hospital. Doctor at the hospital says, why are you here? She's like, my doctor told me to. She's like, well, you shouldn't be here. So she was there for like, I think she might have been there. I think she came back the same day. But guess what, Brandon? She got a bill for that. My stepfather. Now, I want to get the name. I don't know if I'm going to say the name of the drug right because he did tell me what the name of the drug. He has high blood pressure. It runs in his family. He's had high blood pressure for quite a while. They gave him a new drug, and it was, oh, well, I see. He sent me the name, and I'm not. This is another. I'm going to need my grammar teacher for this one. Actually, no, this isn't too bad. Hydrochlorothiazide is what it's called, and it made his sodium level too low. So they didn't even look at this. They didn't look at his sodium levels before anything. So it also drops your magnesium and potassium levels. But all of a sudden, he had a blood test one day, and then at 10 or 11 o'clock at night, his doctor called him because apparently, or his nurse or somebody, because apparently, I don't know, they didn't look at it before then. And they said, your sodium level is so low, you need to go to the ER right now. And it was because they prescribed him that drug. He was in there for 3 days, and he's got a big hospital bill for that. And I started thinking, I'm like, how many times has this happened? Where people are they're telling you to go to the doctor, or they're the cause of you going, to the hospital, or they're the cause of you going to the hospital. And that's just crazy to me. And that's probably something that a lot of people don't think about. They're like, oh, they probably just think that it's all on the up and up, but it's not. So yeah, I just wanted to just refer to that. I just wanted to talk about Medicare and Medicaid. I know there's kind of a stigma around those, and I think that people should really learn that it's the system that's fucked. It's not the people. I mean, there might be some people here and there that are like, it's kind of like what I think of voter fraud. It's like, oh yeah, it happens. What? The percentage that was found by the Heritage Foundation, they said was like 0.00017 per, I don't know what it was. It was really low. And then people are like, oh my God, it's voter fraud everywhere. There's voter fraud everywhere. And it's like, oh my God, no, they're just focusing on that. And that's how it is with this too. Like they're just not thinking about all the other shit. So anything more you want to say about Medicare and Medicaid or vice versa?
My positive, back to my positive silver lining. What's that?
Oh, sorry. That's my getting ready phase. We talked earlier before the pod started how I felt like my eyes were always like, they're not as wide open as they should be. This eye is kind of lazy. It's kind of a little bit of a lazy eye. So I felt like I should be intent. But this is scary, isn't it? I'm looking like Momo. Remember Momo from a few years ago?
No, who's Momo?
It was that weird freaking doll. That weird doll that, I don't know, that people said they saw. I don't know. I can't remember, but it was weird. Well, it's also the modern museum of art.
For sure.
Or something. But go ahead. Sorry.
Momogram?
Yeah. Tell us what you want to say about Medicare and Medicaid.
Yeah, sure. I just think that my hope is that, back to my original statement, I think that it's going to get worse. But I think there's going to be a breakthrough point with AI where you don't get these situations where doctors are doing things that are sort of, they feel experimental, or they're dismissing you because of your class status, or let's just say because you're on Medicaid. And I think that AI presents a scenario where it'll be much more accurate, it'll be faster, it'll be available,
I agree with you
and
all
it
on that,
will
but didn't
be.
we talk before how there's still going to be a class system there? There's still going to be a class system there, Brandon. You know there is.
I think that the floor is going to get raised, though. There's going to be a class divide, but I think the floor is going to get raised up.
Yeah.
So in terms of absolute quality of healthcare, I think that the bottom 50% is going to look more like the top of where the bottom 50% is. Does that make sense?
Yeah. You're
That's
talking
my
about 50
positive
Cent,
prediction.
right? In the club? You're talking about 50 Cent in the club? Hey, shorty,
Yeah,
it's
what
your
was the other?
birthday. Yeah.
I was thinking more of like the white and nerdy. How does it go?
Oh, yeah, they caught me rolling. Well, not am I thinking of the real one? I'm thinking of the real one. Not the Weird Al version. Yeah. Great song though by both.
What's funny is I was trying to think of the 50 Cent version, and I could only think of white and nerdy first. I actually forgot the
Well,
what the
I don't
original
think
was.
50 Cent sings that song. Riding
Oh, who
Dirty.
sings that?
Well, I don't know. You're probably gonna have to look and figure. I don't think it's 50 though. But we're in our 40s, so we have to know things. So you'll probably have to look that up.
I'm gonna look it up right now.
All right, good. It was taking me too long. I have fat fingers. Are your fingers getting fatter as you get older? Is that a healthcare concern?
No, they're fine. Could it be Chameleonaire?
There it is. That's why nobody
Are you sure about that?
remembers.
Yeah. Why did
I
I
don't
think it was
know.
50
I don't
Cent?
know what other song Chameleonaire does.
Yeah.
I think the
All
the
right.
best part about the Weird Al video though is didn't Keenan and why can't I think of his other name? Keenan and who is it? Keenan Michael Key, and they did a show. And the other guy did Get Out. He did the movie. He wrote the movie Get Out.
Thompson? Keenan Thompson? Or no,
No.
Keenan. Wait, what?
Well, Keenan Michael Key is
yeah.
the tall guy, and then there's the other guy. And why can I not think
What's
of him?
funny is I was thinking of Keenan Ivory Wayans for some reason.
Oh, you're thinking
That's
of
not it.
you're going way back to like In Living Color. Yeah.
Yeah. No. No, it's just Key. Isn't it Key and Peele? Is his full name Keenan?
Keenan Michael Key, and then what's Peele's first name?
Peele.
Boy,
Jordan Peele?
thank you. Yes.
You're
And he
welcome.
does, yeah. And then he wrote Get Out, and now he's kind of doing like some of those crazy, scary, those horror movies or whatever. That would have
That's
been a
right, yeah.
2-hour podcast in itself, just trying to figure out those two names. So I'm glad we got it.
It's good content.
Yeah, it's good. It's good. We're moving up in the world. Let's talk about mental health. We've discussed mental health before, so we won't go too crazy with this. But obviously, overall, there's less options available in mental health. Less doctors. We just talked about how there's less psychiatrists and therapists like that are involved, especially for the people who are poorer and have to deal with Medicare and Medicaid. And honestly, like when I go to a doctor about my mental health, I kind of feel silly. I don't know if you do, but like they're not really trained for that. They're trained for medicine and other things. So they're just going to throw antidepressants and anti-anxiety or whatever they need at you, where I feel like, people do need to see a therapist or a psychiatrist or whatever it is.
And I also feel like that is one of the higher areas of medical distrust because, and I feel this too, because I'm talking to this person and I don't even, let me start at the top. Let me just say they are a reputable provider and they're doing everything to a high quality.
Are you talking about BetterHelp?
I'm talking about just mental health in general.
Sorry,
like a psychologist,
Gotcha,
psychiatrist,
yeah.
even a counselor. I know that there is, even within the profession, there are different schools of thought of how different things should be treated. And there's disagreement and some agreement. There's cognitive behavioral therapy and exposure therapy, and there's like mindfulness, like holistic kind of stuff. There is
peyote,
like hypnosis
therapy. I've heard good things. Yeah.
Yep.
Yeah.
And I think there's some other things as well. So that's another thing is like you have to find not only do you have to find somebody who you feel like is reputable, that you trust, that you feel like has, um, that you feel like actually cares about you. That's another thing I would like to touch on.
Yeah.
After I finish this point, but you also have to find somebody who has the approach that matches what you need. And that, and you don't know that because I'm not a professional in what I need, but I know enough to know that I automatically
You know
can't
enough
just
when you
go into
see
this
it,
thing.
right? It's like
Yeah, you
sexual
know, you see,
assault.
what's that? There you go. You're catching on now. You're
Yeah.
catching on. So, that's how it is. That's how mental health is when you're going in to be treated, and you're trying, and then to go back to the other point that I don't want to gloss over too much, which is that you want them to actually care about you. And this is a really hard, like, when I go in, so the times that I've talked to a psychologist in the past, my number one goal has been to try to be the type of person that they like, basically.
Yeah.
Like, I'm trying to be likable, and that should not be the goal
No.
of
But that
somebody
might
coming in. The
also
goal of
just be
somebody,
your personality. That might be, in a sense, a mental issue with your personality that you need. Like, you need to go in there and be like, well, I'm trying to be liked here. Is that bad or good? Can you change that?
yeah, I asked them that, and they was like, "Well, I don't know, but I
Right.
like you, so
Yeah.
well, let's work on it.
Right.
Let's go over the hour an extra
Let's
15
work on it
minutes
until
because
I don't like you, and then it'll be good.
yeah."
It'll be solved.
Well, but that is the thing, is there's these I mean, this is true for like probably any profession in the world where you have to rub elbows with actually another
Yeah.
human being, is
Yeah.
the whole likability
You gotta
issue.
grease them up first, but yeah.
Yeah, grease the elbows.
Yeah, you definitely gotta grease
Um,
the elbows when you rub them.
I usually walk in with a palm full of Vaseline and just let sparks fly, and we see where things go, but they don't always
Back
go
to
to a
these
good place.
Diddy parties all the time with you. All right, go ahead.
Yeah. So, yeah, so I want to be somebody that they like because I feel like I'm going to get better care.
Yeah.
And because when the hour is up, I want them to go, "Hey, the hour is up, so we need to wrap up, in like the next 5 minutes, unfortunately." And I'm like, "Okay, that's fine." Or if they don't like you, then at like the 45-minute mark, they're saying, "Okay, well, we need to start wrapping up," because they know they need to pad out the
Do
edges
you
to
get
make
like
sure
the
they have room for
beatbox
the.
out? I'll wrap up for you, bitch. Yeah.
Okay.
Sorry, that was it.
I thought you were gonna start.
I just wanted to
spitting
do the
some
hype
rhymes.
part. I was hoping you would rap.
Yeah.
You're the pro rapper.
Am I?
Yeah, you're not anti-rapper. You're pro.
That's true. Yeah.
Yeah, you want your candy
I'm
to
like
have rap
a.
on it, rappers on it.
Yeah. I was gonna say I'm like a tag me, bag me, like
Oh, yeah.
throw
Put me in
throw
the
me in the
back seat
backseat
of
of
a
a
taxi.
taxi.
Yeah, yeah,
Yeah.
yeah. Good song. Good times.
I'm that kind of
Sorry,
guy.
I'm kind of throwing you off again, but continue your thought unless I fucked it up.
No, that's my point. Is mental health is a crapshoot, and it's a crapshoot in a different way than other things are because you don't know what's going to work well with you. Even amongst the professionals, they'll tell you that if somebody's not working for you, then you should try switching because you need to find the right one that's right for you. And that's not like when I see a doctor, like if I have a mole and I go see a dermatologist, I'm not going to ask them like, I'm not going to see like, well, see if they're the right dermatologist for me. And if they're not, I'll try. I mean, I understand the value of second opinions, but this goes beyond that.
Yeah, but that's insurance won't let you do that either, though. Or you'd have to probably pay that out of pocket. A second opinion, most
True,
likely.
yeah. Yeah.
That's also another thing.
Yeah. Yeah. So that's my point.
Well, I did want to say that I saw after, because I told everybody here the story about how I was trying to get to that community mental health place, but then I did find a therapist that I had for about 5 months. He was pre-licensed, so he wasn't even a licensed therapist. Also, that is what we get on Medicaid. If people don't know, a lot of times, like if you want to get your teeth fixed, you can go to where you can go to the dental school area where you're having people who are still in dental school do it. You can that same thing for like interns and doctors, and the same thing for mental health. Apparently, we get the pre-licensed therapists that have to get a certain amount of hours in. But I don't want to talk bad about this guy because he was a nice guy, but I just don't think I felt like I had to do all the talking. He wasn't asking me questions. And then every once in a while he'd give me some like piece of advice that I felt like was out of like, I don't know, like a Google search. Like I felt like I could have just found that on a Google search. We had half-hour sessions, but since I did it telehealth, which, so I did it from home, I would go on and my appointment was always at 3:00 every week on the same day. and I would go on at 3, he wouldn't show up until about 3:10, 3:11, 3:12, sometimes 3:15. He told me if it's 3:15 and he doesn't show up, then message him. And then he would wind down at 3:20, and we'd be done by 3:25. So I would get 15 minutes if I was lucky with this guy every week. And I was like, and then I'm thinking, I'm like, in my mind, I'm like, this is how Medicare and Medicaid, well, I guess it'd be Medicaid and that, is fucking the system, because I don't feel like I'm getting any help, but he sure as hell still billing Medicaid every week, you know? And it's like, what the fuck, man? And I don't know how much those guys get paid, but I know that I missed an appointment and I didn't tell him. I told him like a couple hours before, and then I went on the homepage and I went on, like, there's billing there, and they charged me $100 for that missed appointment. And that wasn't, Medicaid wasn't going to pay them, so that's probably just gonna. I'm not gonna pay him 100 fucking, fuck him, first of all. So that's probably just gonna go in a if they don't get rid of it, it's just gonna go in a collection agency, right? So it's like all this shit. I also want to tell you a story really quick. I went to, I think it was for an abscess tooth. I went to an urgent care. So obviously, if people don't know, those are a little bit different than an ER. You got to pay an urgent care. And I remember I went there and I called ahead to ask them how much it was going to be, and they said $100. I said, fine. I went over there. They checked it, gave me some meds, gave me some antibiotics and stuff. And I went to the cashier and she said, it's $94. And I'm like, okay. Gave her the 100. She gives me the $6 back. Brandon, I shit you not. I get a bill in the mail like a month or two later for $6 fucking dollars. I was like, what the fuck just happened? Why did you give me the $6 back? Like, what the fuck? We talked about the rich versus the poor. There's a big life expectancy gap between the rich and the poor. If people don't know, this is kind of taking the extremes, but the top 1%, between the top 1% and the bottom 1%, there's men live 15 years longer and women live about 10 years longer. So that's just kind of an interesting thing. And then, chronic diseases and cancer drive the majority of the insurance costs. And then why does the U.S., we talked about this earlier, why does the U.S. rank number 1 in avoidable deaths? Well, not only does the U.S. have the lowest life expectancy among high-income countries, but it also has the highest rates of avoidable deaths. And the avoidable mortality in the U.S. is rising. In 2019, the average roughly 280 deaths per 100,000 people, consistently underperforming compared to peer nations. That's 280 unavoidable deaths. While peer nations saw declines, U.S. avoidable deaths increased by 32.5 per 100,000 between 2009 and 2021. Key factors include high rates of preventable and treatable deaths. One thing I also want to say, smoking is responsible for over 480,000 deaths annually. Other factors are high rates of suicide. We have the highest rate of suicide, 15 per 100,000 in the U.S. versus 11 on average. Drug-related deaths and motor vehicle accidents are also up there. Those, and if people aren't getting the proper care from those are all unavoidable deaths. Brandon, do you have a blanket statement? Do you have anything you just want to, like, if let's say you're talking to the world right now, or, well, I guess just our country, and you're talking about healthcare and how it's ruining everything and how it's bad for people and how it's just awful. Do you have anything to say to the people? Oh, he's cross-eyed. He's gonna have to call his PCP.
I don't think I have a comment. I've spilled out all the thoughts that I have during this podcast.
Yeah.
A blanket statement that's just gonna make everybody smile when they hear
just
it.
say anything. Don't even have to be about healthcare. Just give some people some hope. You gave a little bit of hope when you were talking about AI, which I agreed with. So, but do you have anything else you want to tell the people?
Don't go to the doctor if you don't have any money. Otherwise,
well, I
was going to
say, I don't think they really can they?
You know what? It doesn't matter. Yeah. That's the problem. I grew up in a family where credit was an afterthought.
Yeah.
And the primary reason for that was because of hospital bills.
Yeah.
It was because it was like, because that was the primary care that you got was through the ER when something
Yeah.
happened in the moment, because nobody has even money for a copay, or they have money for, or for whatever. And so going to the ER was what you did, and it's not good. My blanket statement though is that things are, I'll say it, time number 3. Things are going to get worse, but I think they're going to get better in the long run. I think they'll get better in our lifetimes.
Ooh.
I'll put a stamp on that. I think they're going to get better
I'm
in our
going to hold you to
lifetimes,
that,
but I
man.
think they're
Let's bet
also,
right now. I
yeah,
will. What do you think the future currency is going to be? Rubles? Or is it just going to be like this techno
it's going to
feudalism
be
where it's
something.
all going to be digital?
Yeah, it's going to be
Okay.
digital. It's going to be like Bitcoin.
All right.
I don't think it's actually going to be Bitcoin though. I think it's going to be a layer of coin digital currency that is built on top of
Yeah.
that. But I think Bitcoin will still be like, how our money, our paper money used to, we knew that there was gold somewhere in Fort Knox or
Yeah.
wherever.
Yeah.
There was gold that backed our
Yeah.
money. I think that Bitcoin is going to be the gold that backs the digital currencies on top of it that are much lighter weight that we actually use on a day-to-day basis. But Bitcoin will still be worth a lot because it will be the gold of the digital age.
All right. Well,
And
I don't know what to bet you then. You know what? I'll bet you a
okay,
90s
well,
Chia Pet.
a 90s cheap pet, well, that might be the same value as a Bitcoin at this point, depending on
Yeah, that is
what it
true.
is.
You know what?
You you know what? I was thinking of Beanie Baby
Yeah,
actually.
Beanie Baby. Actually, I've got a
Yeah, I
Furby,
was thinking of,
but I think he's possessed. Like, sometimes
okay.
he comes on when there's no batteries in him. And sometimes I see him in my sleep. But that's for another day.
Why don't you bet me something that really is expensive, like an 8-pack of AA batteries?
That is bad. Yeah, because we're not quite
Yeah.
there yet. How old you got to be to start stealing them? What was it in Seinfeld? Like, they said all old people steal batteries. So it's probably like, 60, 65. That's when you could start stealing them.
Yeah, that's around the
Yeah, you
age.
can just
Yeah,
start
yeah,
stealing
60,
batteries.
65.
Yeah, you're a little heavier than you came in with there. Yeah, they
Yeah.
notice. Well, yeah, I guess if people, I think most people would agree that the healthcare system has to be fixed. And that's really what it bottomed down, like the bottom line is. The fact is, though, is that, we may have to rely on something like AI or something to help us. We may have to rely on something that we wouldn't have thought about 20 years ago to help fix this. Because we all know that the politicians and the CEOs and the lobbyists and everybody's raking in their money. So they don't really have an incentive to fix it themselves. And just so everybody knows, politicians get their own health care. They don't have to deal with Medicare or Medicaid. They don't have to deal with like these ACA subsidies. They get their own health care, and I guarantee you it's going to be pretty close to top notch, I'm sure. All right. Well, I want to apologize to Dr. Mike due to some unforeseen circumcisions. We had to cut the show short. But it's been a great show. And until next time, from us to you, have a wonderful week, and thanks for watching.